Good morning, good afternoon, and good evening from wherever you are. Welcome to University of Liverpool Online webinar. Today we have a very, very special topic, especially to myself. We look into the world of NGOs, we look into the world of project management, and we see how these two connect. And the topic that we chose today, and the story that we chose today actually talks about project management and project managing major health initiatives. And we have a wonderful, wonderful panelist today that's going to share his story on how he actually manages to spearhead projects in parts of Africa that have to do with health initiatives around HIV prevention. My name is Michael. I will be the moderator for today. And let me just quickly go through the agenda so you guys kind of have an understanding of what's happening. So we will hear from our speaker. He will tell us a bit about his background, where he comes from, what kind of, what kind of role does he have right now. We will dive into the world of non-for-profits, and we will look into, how he chose to work in this area and why he did do this switch. And then we're going to look into the HIV prevention initiatives that he is actually helping out with. In relations to the COC Netherlands, we're going to talk about that. It's a huge organization that deals with LGBT rights and HIV prevention around the world. And then, of course, as the title of our webinar, we're going to look at what kind of project management skills does it require for you to have such initiatives and manage such initiatives. And we're going to talk about the University of Liverpool and how the project management master's program helps in building up these skills. So before we get into the conversation, just a bit of house rules. So what we did is that we asked our guest speaker a couple of questions. He sent the answers back. We've put together some deck, the slides that we have right now. But the focus will be more on the conversation and not on the decks. The decks are here just to support the conversation. And of course, this is an open Q&A webinar. So at the end of the webinar, we will have, at the end of the conversation, about half an hour through the webinar, we will have an open Q&A. So you get the chance to actually write down your question, and we can ask our panelists directly whatever question you have in relations to the topic that we're going to cover today. So this is what we have for today. Again, please, if you have any questions, this is the perfect time for you to write them down within the conversation that we're going to have. And the more you put into and the more you interact with us, the more you can get out of the webinar, because it is going to be a wonderful story, and I am pleased to actually start the conversation right now. So let me warmly welcome our guest for today, Munya Katumba. Munya is actually broadcasting all the way from Johannesburg, South Africa. And yeah, hello Munya, and welcome. How are you?
Hi Michael, I'm well, how are you? And greetings to everybody who is on the webinar from wherever you are in the world.
Thank you for that. Munya, can you tell us a bit about your background? What kind of work do you do currently? What is your educational background, so people kind of have an idea of who we have in the panel?
All right, as introduced, my name is Munya Katumba. I am a Zimbabwean, but currently based in Johannesburg, South Africa. I'm a student on the Master in Project Management program at the University of Liverpool. I'm also a Chartered Project Manager. I did my previous project management qualification with Chartered Management Institute and went on to become a Chartered Manager. My role at the moment within Southern Africa covers strategy facilitation, organizational development, as well as coordinating national and regional networks on a regional program that I'm currently coordinating and managing, that I will explain at a later stage. So that's what I'm currently doing at the moment.
Oh, that's so wonderful. And of course, the question is, with your diverse background, at some point you decided to, work within the non-for-profit sector. What made you decide to actually do that? What was the, you know, the moment where you said, this is what I'm going to do?
All right, so my first jobs that I did were within the private sector, and for the past 15 years, I've always alternated between private and NGOs. But the reason why I went to the non-profit is that I'm very much interested in humanitarian work. And that was the reason why I joined civil society organization in implementing the social programs that they implement. It was also because I really wanted to build my personal portfolio, because within the civil society organizations which do civil society work, they are vast in the programs that they implement. I really wanted to engage on a broader scale. So part of what I've done previously with an organization within Africa, which is a coalition of 18 organizations in 15 African countries, was mainly to focus on organizational development, strategy facilitation, and development for their members within those countries. So joining civil society has really expanded my scope of work and development as an individual. And also part of the reason was that I really wanted to develop a business in project management consulting. So by joining the civil society, which have a large scope of implementing programs, it actually gave me a big plus in developing my personal portfolio as a project manager.
Well, that's so interesting, and it's quite a large portfolio because you actually work with a lot of countries from Africa on different initiatives. But the reason that we want to kind of ask you about your experience is also because you have a lot of experience in the HIV prevention area, and this is more or less what the topic of our webinar is about. How does one work with initiatives, especially when it comes to HIV prevention, because it's such a huge undergoing, especially in countries from Africa. So as an expert, of course, and as a person who's been working for so long in so many such initiatives, can you kind of give us a bit of an idea of what the HIV prevention landscape looks like in countries in Africa?
All right, so I think I will start to talk about, you know, the HIV burden as we look in the 80s and the 90s. When HIV came, or when people and governments came to know about HIV and AIDS, it was actually a death sentence. Everybody thought once you have the virus, the next thing you are dying. And as a result, people from the beginning, they actually didn't know how it was spread. And over the years, I think there have been a lot of education within the general population about you know, HIV and AIDS, how it's spread, how you prevent. And most of the countries, they've actually managed to contain the HIV prevalence rates within their countries. I find that in the 80s and the 90s, the HIV prevalence, especially in sub-Saharan Africa, we're ranging, I think, you know, up to 35–40%, which was a huge burden. Oh, wow. So a lot of countries, they've managed to contain it within the general population. So now most of the issues that we are focusing on, some of the, what we call, according to WHO, that's the World Health Organization guidelines, what we call key populations, those that are hugely affected now, those that are left out within the general population HIV and AIDS prevention messages. So first, we have issues of homosexuality. It's a topic, it's taboo within most of the African countries. And as a result, even the laws, they criminalize same-sex behaviors. And as a result, a lot of LGBT, what we call the lesbians, the gay, the bisexuals, or the term that is used in public health, men who have sex with other men, they do not seek the health services that they are supposed to seek because they fear that they will go to law enforcement and report themselves. And the huge issue is mostly it's a criminal offense. As a result, people are afraid that once they are arrested and prosecuted, there is, a number of years that they have to spend in prison, or life imprisonment for other countries, and for other countries they even have a death penalty, which is a huge problem and a huge burden, especially when it comes to attaining health outcomes as it relates to everybody within the countries. So as a result, most of the programs that are being implemented by my organization or that I coordinate actually target LGBTI or issues of homosexuality. The second part is drug use. They've been proven that injecting drug users within their populations, there is a high HIV infection rates. In countries like South Africa, in countries like Kenya, but mostly some countries within Africa, they didn't actually acknowledge use of injecting drugs. But we still have a burden because mostly people use drugs, and this actually affects the way they make decisions. As well as also there are a lot of interventions by civil society organizations in terms of harm reduction. And as a result, when people try to work with law enforcement agencies, the drug users are arrested. And sometimes the needles that are used, especially in harm reduction, they are confiscated. And as a result, it's actually an issue because some of the programs that are supposed to reduce the HIV infection rates, they are being hindered because of police actions. So that's why currently we're also working with drug users. And the last bit is on prostitution. It's criminalized, it's illegal in most countries, and most of the programs in HIV prevention, they issue out condoms. And in most countries that we implementing programs, there is a huge problem because police actually use the condoms as proof that they were trying to solicit for customers within the, wherever they are operating from. So which is a problem. And also as a result, what has been happening, a lot of police officers within most African countries, they actually demand sex from the sex workers so that they could then release them, which is a problem. And when they do so, in most cases, they don't use protection. So the police and law enforcement that are supposed to be the ones that are supposed to protect and provide safety for these key populations, they are actually the violators of human rights, and they perpetrate violence against these populations. And also for South Africa, for example, and most of the countries, you find out they've managed to contain HIV within the general population to around, maybe most of the countries, around maybe 5%, within maybe the range of 5%, maybe to 15%. Most of the countries, they've managed to do so. But within these populations, you find out within MSM, for example, in South Africa, the HIV prevention, the HIV prevalence rates go up to 35, 45%. Within the sex workers, it actually also goes to 70%. So this is more of the background to the programs that I'm currently managing within Southern Africa.
Okay, and it's good that you actually mentioned that, because there is an organization that is funding a lot of these programs, an organization that you actually work with, and we're going to talk about that now. Can you tell us a bit more, or can you give us a bit more information on the COC Netherlands and how it helps these kinds of issues? And of course, just a bit of background of how you are involved with COC Netherlands.
Okay, so COC Netherlands is a Dutch LGBT organization that is actually the oldest lesbian, gay, bisexual, trans organization in the world. It was formed in 1946. And by then, when it was formed, it was mainly to provide safe space for gay and lesbian women, so that they would not be, they will have safe spaces where they can go and meet other people, talk about their issues and so forth. But currently, it has grown from just implementing and providing safe spaces within Netherlands to providing grants to LGBT organizations globally. At the moment, COC works in Africa, Southern Africa, East Africa, North, even within the Middle East region, Central Asia, Latin America, the Caribbean, Eastern European countries, and so forth. So these are the countries that we are currently working in. Our sole purpose is mainly to work with country or local organizations that are advocating for policy reform, so that members of the LGBT community within those countries, they enjoy human rights to the fullest that they can. So okay. These are the programs that are implemented with COC. Our role is to sub-grant to local organizations who would then implement. So mostly what we are working on is reaching to the global goals of the UNAIDS targets, to ensure that 90% of people who are HIV positive know their status by 2020, as well as also 90% of people who are HIV positive are enrolled on the antiretroviral therapy, as well as also that 90% of the general population, they are also reached with HIV prevention messages. So these are some of the global goals that we are contributing to with the programs that we implement.
Okay. So there are a lot of cross-referential programs, because I'm guessing that it's not only about the LGBT community, but also it involves people who have drug uses, and also involves the sex workers. So these projects kind of intertwine and try to solve the same goals as mentioned here, and the global goals for the UNAIDS HIV targets. And I do have a curiosity: how much of these goals are already met, and how much, from your perspective as an expert, what is still the hardest to still achieve by 2020 in your perspective?
I think what's very important is the monitoring and evaluation of the programs. Measuring the impact on the ground. I think that's where we still have problems within the countries. The issues mainly, like I have raised, are in some of these members of the community that are left out with programming. And the reason why we have grouped the three key populations, which is the LGBT community, the sex workers, and the drug users, is because of the intersectionality of the issues. And I will explain further in one of the programs that we are implementing in Southern Africa, actually in the 5 Southern African countries that I'll explain just now. But mostly, to answer your question, the problem is in the monitoring and evaluation, just the measuring of the impact itself, to know that the program, the HIV prevention messages and the programs that are implemented, they're actually reaching the 90-90-90. Okay. So but I strongly believe that this is a little bit ambitious in terms of attaining the goals, because there's still a lot of policies that need to be aligned so that people are able to access the services to reduce HIV prevalence within the countries.
Perfect. Thank you. Thank you for that. I mean, it also is clear that these are very ambitious goals, but I think that also the purpose of the UN goals are to be ambitious, to push people to, work harder, and especially non-for-profits to implement as many projects as they can to actually make sure that these goals can be achieved to the fullest of the capacities of the social sector, and also sometimes the corporate sector also gets involved in some of these projects. There's a lot of project management to be dealt with, because all of these involve projects that need funding, projects that need coordination, projects that need all sorts of information loops. So the question right now is how do you project manage these initiatives? Which kind of skills have you been using to make sure that these projects are implemented to the fullest of their their scope?
All right, so I think maybe I should start to mention that non-profit, they employ a lot of what we call field workers. So within the project, instead of employing a project manager, they would rather maybe employ a social worker to implement a social breast or a development program, or a doctor if it's mainly maybe health related and so forth, or maybe if the program is implementing maybe ARV therapy and so forth. So it's project management skills is really a scarce skill within the non-profit. And so what I'll also do right now is I'll explain the project management life cycle within the programs that COC implements. Mm-hmm. So within, for example, the countries that we're working in on one of the programs that we're working with, the key populations that I mentioned, initially what we do is we do a needs assessment and context analysis to just get to know, within a country, what are the policies, what are the laws, stakeholder mapping, who is already doing what in the countries, to just have a feel of baseline information on where to start. And then from there, what we do is we develop what we call a theory of change. So these are the steps within the short term. What are the goals that are expected? What are the results that we should expect? And then within the medium, and then within the long term. So for example, let's say if we want to change certain laws. So the short-term goals might start by advocating and lobbying maybe parliamentarians, so that these issues are tabled in parliament, and then it goes to issues of actually aligning certain laws or policies to ensure that some of the laws are decriminalized and so forth. From there, we also make sure that our partners that we sub-grant to, they also develop work plans that they align to the change that they want to see within their localized or countries or within their region. We also ensure that there is reporting, there is medium-term and long-term evaluation of the programs, and also to ensure that when the programs comes to an end, there is proper maybe handover and proper program closure. So the program life cycle requires project management skills. So within the degree that I'm doing, there have been a lot of leadership skills in terms of networking within the countries, because also my job basically doesn't implement on the ground. So what we do, we work as COC, we work with the country partners. So within the country partners, my role then becomes to lobby and negotiate with the ministries of health in some countries, with national AIDS councils, so that they're able to interact and work with our local partners. So in doing so, there is a lot of leadership skills that are needed to discuss these issues with the country directors, as well as also networking. There are issues of ethics and values. And also, I think the huge part of it is trying to convince the local governments that criminalize, especially maybe prostitution and sex work, to ensure that they include within their programs issues, of same sex. So to them, that's more like, agreeing that these problems are actually happening. If we take, for example, of Zimbabwe, I think we know of President Robert Mugabe's stance on homosexuality,
Yes.
right? And what I would tell you right now is the program that we are implementing is working with the Zimbabwe Republic Police. And one of the things that I had to do as the project manager was to negotiate with Zimbabwe Republic Police to work with the LGBT community in Zimbabwe. So that's where most of the skills come in to ensure that they strongly believe that what they are doing affects the health outcomes of the country. But in doing so, I do it with the local country partners. So there are a lot of skills and knowledge about the country that is also needed. I also do a lot of mentoring and coaching on project management so that the country partners, they are well aware of the program life cycle, when to report, how to report, and so forth.
Very interesting. And your role seems to be very diverse and very country to country customized. In some cases you have to deal with governments, in some cases you have to deal with police. It's very interesting. And this kind of leads to the next question. I mean, you have such a busy schedule and probably you travel a lot. How did you manage to also do a master's degree online? And why did you choose specifically the Liverpool one? Why did you choose the Masters in Project Management one with the University of Liverpool Online?
I think I want to start to say that for now, I think for the past 2 years, I didn't have a life. It has been either work or you are behind the computer again, doing the schoolwork. But to answer your question, my work involves a lot of travel within Southern Africa, within the Africa region, as well as also back and forth because I'm consulting for a Dutch organization. So most of the times I'm always at an airport and going somewhere. But why I chose the degree is mainly because of my busy schedule. I had no time to be in class and attend taught lessons. So my best was to attend class wherever I was at in the world. And so that was part of the reason why I chose University of Liverpool, because it suited my schedule, that I could be in class any time of the day. So that was part of the reason why I ended up with the University of Liverpool. Also, I think what I wanted to do was also to gain a qualification that is credible. So I really wanted to do a UK degree. So when I did a Google search, University of Liverpool was one of the universities that came, and I also wrote, I think, to 3 or 4 universities by filling in the online form. And the good thing that happened was University of Liverpool was one of the first that responded and was very proactive. And was very proactive. I was assigned someone to help me with the, submitting the documentation and so forth. So some of the universities that I had applied to, they were actually left out.
Okay.
And then also, I think I also read that it was also part of the Russell group of universities, which also gave me the, more of credibility that it's a good university that I wanted to enroll in. And also it has also been proven over the past how many months, maybe 18 months. I started in February 2016, and I've gone through the 8 modules because I did back to back. I had no time to rest and stop.
Oh, wow. Congratulations.
Was also part of the reason was that it was very interesting for me to learn, and I've always enjoyed reading and writing. So it was really interesting and exciting journey. So that's the reason why I completed. And now I'm on my level where I'm doing my 4th week on the dissertation.
Oh wow! So you started your dissertation module. Well, good luck with that. All the best with your dissertation project, and I'm sure you're going to do a great job with that.
Yeah.
Thank you.
But then also one point that I left out is it's, for me, it's a stepping stone for me to move on also to do a doctorate or PhD, depending on what I want to specialize in, which I'm still thinking about.
And this is the next question for you, and thank you for jumping to it. So, what is that next step? How do you see yourself, with this degree after you finished it, and with all of this, great experience that you have? What do you want to do further in your career?
Okay, so in my career, what I want to do is the reason why I ended up within the non-profit was that I want to develop a business in consultancy, especially focusing on project management. As I've said earlier on, project management is a scarce skill within the non-profit. So part of what I'm thinking, what I'm organizing is that if I build a business, because already I've worked at country level, I've worked at regional level, I'm covered within I've worked in 15 African countries, and now COC also, as a result that they have seen, the confidence that I have in presenting in meetings, and also the work that I'm doing in Southern Africa is speaking for itself. They've kind of increased my scope from the 5 Southern African countries that I'm working on to 16 global countries in all the regions. So this will suit well in the next 5 years when I develop my business in consulting. So that's part of the reason that's part of what I want to do as an individual in the next 5 years. The secondly is, like I mentioned, I want to specialize. So I will move on as soon as I finish my master's. I'm moving on to doing a PhD or a doctorate.
That's perfect.
So that's my next 5 years.
Yeah, and good luck with that. I'm sure you're going to have a lot of work to do, but it is important work. And with that, actually, we come to our Q&A section of the webinar. Thank you, Munya, for sharing this wonderful story. There you have it. Someone who has passion and the skill set to actually produce change in parts of the world. And there's a story that anyone can be inspired by. And I'm sure that our audience out there are very curious to find out some more things. So let me just get to the questions. This is the first time that I'm reading them, and they've been sent out by our producer, and they've been collected from our audience. So just bear with me until I go through some of them and we can address them here. Yeah, there's always a question that a lot of people are asking, especially with your kind of job where you travel a lot. How do you manage to fit time for study in your busy life? This is one of the questions from our audience. Munya. Can you hear us? We might. Munya, there you go. Did you hear the question?
Yes, yeah, I lost you for some seconds.
For a couple of seconds. Okay, so the question that we have, the first question from our audience is, how do you manage to fit study in such a busy life with traveling and work? How did you manage? I think that's a golden question that everyone has on their mind.
Okay, so I think I also forgot to mention that part of its work, it's school, as well as I also do holidays in between. So how I have managed, when I travel, I make sure that I open all the pages that I'm supposed to read. So at airports, when I'm in a plane, traveling to somewhere, I'm reading and preparing myself. When when I have a spare time, I'm always reading, I'm always in class, apart from the work. So I have a schedule dedicated that 8 to 5, most of the times I'm doing work. And then after hours, I make sure that I dedicate 3 to a maximum of 5 hours to doing schoolwork. So most of the times I do not have time to rest. And then also to what I also do in between, I also make sure that I do exercises. So 3 to 5 days, I also go to the gym. So this also helps me to relax a little bit and make sure that my mind is well focused. So these are part of the personal things that I do to ensure that I still come back and sit behind the computer. But most of the times of the past 2 years, to be honest with you, it has always been school and work, because I've done it back to back.
Okay. The next question is also, yes, yeah. I can hear you. Thank you for your answer, Munya. The next question is also a bit related to the first. Someone is curious of what was the most important thing you've learned during your study at the Liverpool University, because you've almost finished your degree. So what do you think is the key thing that you've learned that you can say that it's the most important?
Okay, so for me, what I learned most is sustainability. There's a module that we do on looking at, people, profits, and also ensuring that we keep our environment, which also includes issues of ethics and values and morals and so forth. So this skill has actually helped me in building the networks within the governments that I work with. Most of the African governments, they talk about COC as a Western organization, sometimes coming to promote homosexuality or same-sex behaviors within, some of the countries, right? Which is not true, because in most cases, we want to improve the health outcomes of the United Nations. So the ethics and values actually builds my confidence, so that when I go and do the presentations, I'm very confident to ensure that I link it up to sustainability of our world in terms of people having or attaining the rights that they need, aligning, the necessary policies and the laws, so that the top skills that are done.
Okay. Now we're going to go a bit towards the topic of our conversation, and we have a question that says, so looking at the increasing number of HIV prevalence recorded every year, which actions should be done in priority and at which level to reduce HIV prevalence proven to be detrimental to countries' development? So what would you say that is the most important thing to be done, and at what level? Is it ground level? Is it governmental level that can actually improve the situation of these countries?
Okay, so I will start at individual level. So at individual level, we're talking of building the confidence of the sex workers, the drug users, and the LGBTI community, or men who have sex with men, so that they have the confidence to seek health outcomes, to seek health services. So that's what we are looking at individual level. We should build their confidence so that they're able to go and seek those services. At organizational level within the countries, we're looking at sustaining the organizations by making sure that they have the structures in place, they have they are well aware of the issues that are happening at country level, so that they are able to advocate within their spaces. At structural level, that's more at ministries of health, national AIDS councils, government level. We're looking at aligning some of the policies and the laws to the global or health outcomes. There are bad laws that they are still keeping within the country. So we want those laws to change so that they align to what the individuals see as a hindrance to, for example, to seek the health services that they need. At global level, I think there should be advocacy at global level to push the countries so that, especially maybe at United Nations, at WHO level, so that they also have certain policies and they also continue to provide maybe some of the necessary funding, although I do not support dependence. But I think also in doing so, they should be able to make sure that the governments sustain some of the programs that they are implementing, either through local initiatives and so forth. So this is some of the things that we are looking at so that we contain the HIV virus. Because if you see, most of these, what we call key populations, they are actually also living double lives. They might live their same-sex, within their same-sex relationships, and the fact that they also want to be part of the broader social or broader society, they also behave in certain ways that they acknowledge. So they end up in reality doing what are perceived to be normal things, which that we want to make sure that people actually understand that these services are needed to ensure that everybody attains human rights, everybody attains the health that they need, everybody have the freedom to be who they are.
That's wonderful. Thank you for that. And I have one last question from our audience before we wrap things up. So your job sounds very risky. How do you protect yourself from all the various threats, from health to legal issues and potential conflict? That is an interesting question.
Okay, so when I worked at country level, what I did was I associated myself with a lot of embassies, right? In the
Can you hear me? Yeah.
Okay, looks like it's
a bit of a delay.
Okay.
So what I understood that you do associate yourself with a lot of embassies. That where I lost you. So continue on that note.
Okay. So I make sure that when I am in trouble, I have an embassy to call and quickly I'm rescued or something. But that have never happened to me, because also I'm very confident in the work that I do. I don't do it behind the scenes. I follow the instructions, because most of the countries, what they do is they want to engage, but what they have specific things that they want. For example, certain countries, they would tell me, Munya, come into the country, we're going to discuss, but everything has to be behind the scenes. You cannot announce, you cannot do anything. So these are some of the rules that the governments give me when I engage with them, which I adhere to. As well as also that I'm very confident in the work that I do. So I explain it so that they know that they need to change, so that there are benefits. For example, within the South African police, COC managed to sign in a memorandum of understanding that covers sex work, which is criminalized, drug use, which is criminalized, and it's only LGBT community that are covered by or protected by the Constitution. But they managed, and I managed to also convince them as part of COC strategy that I have, that there is need to change, as well as also that our strategies are linked to global outcomes. So most of the governments, they engage at that platform, knowing that they will benefit in the end.
Oh, that's so wonderful. Thank you for that, Munya. And then there's just one last question from my part. So if for anyone who's thinking about taking a project management degree within the University of Liverpool, what would you advise anyone? So what would your final advice be that anyone who's listening and is thinking of joining an MPM program with the University of Liverpool Online?
Hello, yeah, I'm back now.
Yes, so one more
Michael?
question for you. Yes, I can hear you. I hope you can hear us. I have one more question for you on my behalf before we wrap things up. So what would be a last piece of advice that you would give anyone who would be interested in joining an MPM program with the University of Liverpool Online?
Okay, so what I would say is the content for all the 8 modules was very relevant to the work that I do. And most of it, it's more like I'm in class as well as I'm practically applying it. So that was what I actually saw with the MPM program, as well as what I would say is it needs a lot of personal motivation, dedication. You have to be in it to be able to do and succeed. There's a lot of balancing between, personal and work. So all those factors, you need to bring them in, as well as also what I've found good for me is the flexibility in the payments. So I chose pay as you go, and I've managed to pay bit by bit, which suited me very well. So that's one of the things, and just to say, it's a diverse of topics, whether you are on the straight tracks or you are on the general. For me, I was on the general track, which was also good and very relevant. So it needs a lot of personal motivation. You need to dedicate time. So these are some of the things that, as individuals, you need to do to ensure that you succeed.
Thank you. Thank you so much, Munya, for that. Well, there you have it. You need motivation, but with a job that requires you to travel, with a busy schedule, you still can manage and you still can have an impact in the industry or in the job that you want to seek out for. Thank you, Munya, for sharing your story. I think it's a wonderful story, and we can learn a lot of things from your effort and your impact and the work that you do, the good work that you do for the HIV prevention initiatives and also for the LGBT community within Africa. And with this, I want to close off by saying thank you for joining this University of Liverpool online webinar, and I hope to see you soon back again, either in class or joining us for another webinar. Thank you, Munya, for being part of this, and enjoy the rest of the day.
All right, thank you very much, Michael and Joe. Enjoy your day too. Thank you for having me.
Bye.
Bye.